Homeschooling gives 5-year-old Natalia Filak the basics she needs to stay on track. But her mom, Megan, knows her little girl is missing the normal life that was suddenly snatched away when the pandemic took hold last spring.
She calls it the germ fight, and she tells me, Mama, I can't wait for the germ fight to be over. Mama, do you know when the germ fight is over?
It's the heartbreaking question no one can answer, but experts say vaccination is certainly part of the solution. Pfizer's vaccine has been approved for people over 16. With Moderna, it's 18 years old. Both still need to study those same shots in younger kids, though. And recruitment for clinical trials involving children has struggled, with the head of Operation Warp Speed saying last week Moderna's testing has less than a third of the participants it needs to get a full picture of the vaccine's impact on adolescents.
It's a real challenge.
Also challenging, the clinical trials happening right now are for kids over the age of 12. Moderna said recently it'll likely be 2022 before data is available on babies and children 11 and under, putting widespread vaccinations before next school year out of reach.
We knew that vaccine development for children would be a little slower. That's part of the vaccine development process.
Still, Dr. Lee Beers, president of the American Academy of Pediatrics, or AAP, says manufacturers need to act with the same urgency they did when developing an adult vaccine, while still maintaining the safety protocols they've used for decades.
What's different when kids get involved in the equation?
Kids are growing and developing at a rapid rate, and that means that they respond to medications differently. They have different weights. They may have different immune responses. And so we just have to be mindful of that and a little bit more cautious in the clinical trials.
That caution is why she says parents should feel comfortable getting their kids vaccinated once a COVID shot is available. It's important because while the AAP says coronavirus cases in children are rare, more than 2 million kids have tested positive since the pandemic began.
Children have been hospitalized, children have died, and so while children fare much better with coronavirus than adults, they still are impacted. I would also say that children are impacted in other ways by the pandemic. So it's important for kids to be able to get back out and leading their day-to-day lives, and a vaccine strategy is an important part of that.
Getting back to the normal day-to-day is something Megan Filak and her family look forward to. They're preparing Natalia for kindergarten and doing their own education as vaccine trials for children roll on.
I do think that by the time it gets down to them that, we will feel comfortable getting the vaccine for them, that will be the best choice to protect them. But until then, we are going to keep our eyes on it and keep watching and make sure that we feel comfortable and that all our questions are answered.
I'm Josie Sturman for Spotlight on America.